Driza, 8:25 on a throwback Thursday, Thuggin' Thursday, the 3rd of July, 2025. Driza Munyaradzi, because our doctor's in the building. Good morning, Dr. Munya.
Morning, guys. How are you doing?
It is so good to see you in the studio, Doc.
Yeah, I feel like I'm the throwback.
Yeah.
You are a throwback.
This is the proper throwback.
We're like, wait, what?
Hey, the doctor's in. Should have found better, doc.
Yeah, it's been okay. But I'm always here anyway. Like
In spirit.
In spirit.
In
Yeah, I'm
spirit,
always hearing you guys and chit-chatting
yeah.
and taking part.
We don't like you as a monitoring spirit. We like you as a
Muri
physical.
munomdara.
As a physical. And now
Yes.
we'll make sure that happens.
Right, Doc. I want to talk about this case. I know it's been a hot point all over the globe.
Yeah.
Nyayema DNR, do not resuscitate, as well as euthanasia and palliative care.
Yeah.
Can we talk about DNRs for now?
Sorry. I need to take you back.
Though? Okay.
What is euthanasia?
The euthanasia.
Yeah, like
Okay.
euthanasia is giving something fancy. Papa don't know.
There you go. The doc's in the building.
Mpopo Kwema was riding. See how it is,
Whoever was
maybe.
writing.
Yeah. Anyway, so I'm gonna give you like a bit of definition on what do not resuscitate is. So resuscitation means to revive or to restore life. That is to bring back from a state of unconsciousness to consciousness. Okay. It may also mean to bring back someone to a normal vital function state. Right. Like for example, if your blood pressure has not been okay, we can try to resuscitate you and make sure that everything is fine. If you're dehydrated, we make sure that you're hydrated. Yeah, so I wanted to talk about this because I had two scenarios that I came across, and one of them was of a quite elderly lady. She was brought in by one of the relatives, and they said, you know what, doc, she's not feeling well, but whatever you do not over-investigate. That's number one.
Wow.
Number
Over
two-
investigate.
The family can say that.
Yes, this is stuff. You know what? During all my years of practice, I'd never come across this, but I've heard about it.
Okay.
So now this really triggered me to say, you know what, we need to talk about this
Yeah.
a bit more. Okay. So the family said, do not over-investigate.
yeah.
Do not over-treat. I'm going to explain what that means.
Okay.
Just do all you can to make sure that she's comfortable.
Okay.
Okay. And then on the other side, I had a similarly aged patient who came in with sort of like the same symptoms. And the family was running around. You actually had more people coming in to see this guy.
Yeah.
And they would ask for CT scans. They're asking you to do all those things, the colonoscopies and all the blood work. Okay. So that gave me like an idea to say, you know what? We need to figure out exactly which are the patients, or which patients are you going to say most likely going to say do not resuscitate or not.
Or we want to prolong this life.
Exactly. So we're actually beginning to encounter some of these scenarios more often, even here in Zimbabwe. It used to be something that we
Watched on TV.
yeah, exactly. Yeah, in the
I was
West.
Dr. House. I've seen plenty of episodes of Dr. House. He's got a DNR. What are you doing? He goes,
Grey's
"No."
Anatomy.
Grey's Anatomy.
Ah.
No, they can live. No, they said DNR.
Exactly. So let me define what DNR is. So DNR is do not resuscitate, and is defined as a medical order given to a healthcare provider to not perform CPR. I'll explain what CPR is. That is if the heart and lungs stop working. So that's cardiopulmonary resuscitation. So
Okay.
if you collapse, we can then start compressing your heart. You've seen that on
Yes.
TV, and then trying to also help you with your breathing as well. So someone would then say, can you not give me that type of care in the event that I actually collapse?
Does that have to come from the patient? Or the family can say DNR?
Okay, we are getting to that as
Okay.
well.
All
Okay,
right. Okay.
so it's different from do not treat
Okay.
or do not give me palliative care.
Okay.
Okay, in this scenario now, someone's just saying, you know what, don't give me drugs, don't give me IV fluids, just
Let me go.
Let me go.
Slip
Even
away.
food as well. You can restrict food and all that other support you can give me.
But that's like making a decision to die.
Yes, it is.
As
It
a
is.
doctor, are you
Bound by any...
bound by any laws, I guess?
Yeah, laws
To then say,
or-
okay, this person's decided this, so we are not really treating them. We're making sure they're comfortable.
Because when my ethics got
Isn't it?
involved.
Yes.
Yes. Thank you very much. So, yeah, while I was preparing this, I had to go into the chapters.
Yeah.
In my chapter in Zimbabwe, where we have to now figure out where are we doing harm and where are we not doing harm.
Right.
So, as long as we are not assisting someone in committing suicide, okay, or killing themselves, it's pretty much within the law.
But you're assisting them by starving them.
No, a person is allowed to make a decision concerning their life.
Legally, how does okay, I know you probably don't have the law degree to respond to this, but from your perspective as a healthcare practitioner, how does that stand, even with you? If somebody says, This is probably a 35-year-old who's quite healthy,
Yeah.
but they're just like, you know what? I've maybe
Do not treat.
maybe they tried to take their life. Vakatadza. Right?
Okay.
Now they come into the hospital because somebody brought them in and you have to take care of them. And they're saying, no matter what happens, if I
not
go
treat.
into a worse state, don't treat me, don't feed me. How do you handle that?
Okay, as Dr. Munya,
Let's talk someone. Yeah,
I'll
yes.
tell you personally what I'll do.
Yeah.
If you have a 35-year-old and we are really looking at this person, we are figuring that they might have a psychosocial problem that they're dealing with, then they probably need counseling. This is a patient at high risk of committing suicide as well.
Yes.
Again, yeah.
So within that scenario,
Yeah.
that is a client that we would call in all the behavioral therapists within the hospital to come and talk to this person. We can even bring the people from home to try and help and see whether there's something else that is actually pushing this person to say, do not resuscitate. Okay, or just let me go. All right, but if we have exhausted that, like I said, the law allows the person to make a decision on how they need to be treated. Someone might decide not to even show up to the hospital anyway,
Right.
so it's still within their decision,
Making,
right?
yeah.
We have children that are under 18. Of course, those ones, they will need a guardian to make the decision on their behalf. But as long as you're above 18 or you are of a sane mind, then we can allow you to make that decision.
All right, Doc. Thank you for adding sane mind there. But I'm going to throw it to you. If someone comes, they're 35, Noxy said, do not treat. And you say, but this chick's got a chance to live. And you treat me. What happens to you? Can I take you to the popo?
All right. Yes, you can. Yes, you can. I'm not very sure about the punishment, the consequences
yeah.
here in Zimbabwe. In other countries, yes, you can be fined. So with a DNR, there is a written DNR, and then there is a verbal as well. As long as we can confirm that the patient had a DNR request within the health facility, then you should honor that decision. All right. But unfortunately, sometimes this can happen. We have different doctors working within a hospital. I'm the doctor treating the patient, right? And the patient has probably communicated to me that they need a DNR.
A DNR, yeah.
Exactly. But then
Do they have to sign on it?
yes, they can.
Okay.
We actually give
All
them
right.
like a forms or somewhere where they can actually write that
Okay.
I need a DNR.
Yeah.
For some reason, I'm attending an emergency somewhere else, and then another doctor comes in. They're not aware that this patient say DNR.
Do not resuscitate, yeah.
Exactly. They can still go ahead and resuscitate this patient.
And they're okay.
Yeah, they're okay because they within the boundaries of the law,
Okay,
they
yes.
can't be
Held liable for
for that because the communication was between the
Yeah,
doctor
yeah,
and the
main
client.
doctor.
But it's our mandate again as a healthcare providers to
Yeah.
then talk to the other healthcare workers within the hospital to say this patient is a DNR patient.
Doc, we're going to come back and talk a bit more about this and euthanasia after this.
Zimbabwe's
Talkie Vibes, Lonely, the doctor's in, and we are talking just, I don't even know.
DNRs.
DNRs,
Yeah.
euthanasia, and
Sparking the laws around it.
yes.
Yeah.
What's euthanasia?
Triviality that I just wanted to say.
Okay.
So, people get tattoos, right?
Yes.
So there's been this trend where people can write DNR on the chest.
As a
Because remember,
tattoo.
CPR,
Yes.
you have to have your,
chest open, yeah.
your chest open, and then you have to get the shocking and whatever. So people have a tendency of writing DNR on the chest. That one we do not.
You don't
Oh, you
consider
don't
that.
we
count
don't consider that one. 'Cause
it's a tattoo.
Imagine people have been drinking, and then they're like, you know what? I'm going to get a DNR tattoo. And you know what? The decisions can change over time, but the
Yeah.
tattoo will still be there.
But tattooage is probably Denise, Noxy, and Ruvim.
Exactly.
Exactly. So we really don't honor the DNRs
Okay, all
on
right.
the
Okay.
chest. All right.
Okay.
So euthanasia, really, we call it mercy killing. Okay, where we're saying a doctor feels that this patient has been suffering, and the patient also says, "Doctor, I've been suffering. I've had this cancer for a long time, or I've been treated of this blood dyscrasia or blood problem for a long time, and I'm in pain. Can you just give me something so that at least I just go in peace?"
Peacefully, yeah.
Yes, you can give them a high dose of something. Okay, and then
No,
they
thank
die.
you for not saying what the something is.
Of course.
Because I saw you go, I was like, oh.
Oh, no, don't say it.
Please don't say
Okay. In Zimbabwe, what does that look like for us as a nation in terms of euthanasia? Do
we have it?
a law?
Yes, there is a
There's a
there's
law.
a law. There's a law.
Okay.
So if you go to, I think it's called section chapter 5 or something like that, where they actually talk about what is homicide. Okay, if you assist someone in killing themselves, it is considered a crime in Zimbabwe. regardless of the situation.
Okay.
All right. I know they
So
are.
you mean vava vanoti kana munhu akati ndichazvisungirira kuti iyi tambo yehomicide kana
So
akazvisungirira.
if you own a hardware and you know this person wants to commit suicide
And you sell them.
and you sell them,
Wow.
Are you serious?
yes, you are assisting in murder. Yeah. So in our medical fraternity, it's
Wow.
one of those things that we also have to deal with.
Yeah.
To say, you have to tread carefully. For example,
Yeah.
you find a person that you're treating for like cancer. They need, say, morphine or some drug that helps them to alleviate the pain.
Yes.
You have to increase the dose gradually to manage the pain.
Yeah.
But there is always a balance between what is now a very
It's too
toxic
much
dose
and what's not, yeah.
and then a dose that can actually take the patient's life. And you have to then go in front of the court and without a doubt then prove that you are actually treating the patient for the pain and not
And not trying to.
helping them to kill themselves.
Okay, so is it something that's allowed in this country?
No, it's not. But like I said, you are assisting a person in committing a suicide.
Pretty much a
So
homicide.
it's pretty much a crime.
You?
Sure.
Okay. Palliative care.
But anyway, I'm against it.
Yeah. Let's talk palliative care. What is palliative care?
So palliative care is when we have a patient with a condition that we have deemed is not curable, or now they're terminally ill, and there is no way we are going to make this person better in terms of the condition itself.
Yeah.
But there's things that are uncomfortable for the patient, like pain is one of them. Maybe they've been vomiting incessantly, or they have having difficulty with breathing, or they have sores, maronda akubuda, those different places.
Yeah.
So with palliative care, we're just saying we are going to make the person what? Comfortable. Exactly. Yeah. So it pretty much goes in with what we are trying to discuss here, where we have to choose exactly what are people saying. Is it do not resuscitate? Is it do not treat? Is it palliative care? So you find that a lot of patients who are being treated for cancers, if it's terminal like stage 4, we're saying we cannot do anything. Maybe they've received chemotherapy. We can even say, can we stop the chemotherapy? Because the chemotherapy is not working anymore. So now we give them medication to just help them to be comfortable during their last days.
Okay. Well, Dr. Munya.
Have you ever had to deal with someone who's going through their last days? Like someone who's like medication-wise and like, you know what, chemo's not working.
Yeah, we do.
What
Quite
toll
often.
does that take on you as a doctor?
What's that?
What toll does that take on you as a doctor? When you get to that decision and you have to have that conversation.
They're very difficult conversations.
Yeah.
I remember telling somebody that, you know what, someone walks in, they've just had a baby, you're like, oh, yeah. The next thing, someone walks in, they're terminally ill, and you have to change the mood. So it's quite difficult, but, well, it's part of
That's
the
your
training.
profession, right?
Hey.
It's part of the
Yo,
training.
doctor, the doctor's in. Munya, thank you very much for joining us this morning. We'd missed you, bro.
Wow.
We appreciate you pulling up and hanging out with us. I'm sure we'll probably have a bunch of messages on our WhatsApp asking questions about what we were talking about today. But hopefully you can come through again and have a chat with us, and we'll discuss further. But right now, headlines coming up.